Imagine your heart is beating normally, and then, somewhere inside your chest, the blood supply to part of it suddenly gets cut off. What happens next is far more terrifying than most people realize. Because during a heart attack, your heart usually doesn't simply stop. Instead, part of the heart muscle begins running out of oxygen. Most heart attacks begin with a problem inside one of the coronary arteries, the blood vessels that supply oxygen-rich blood to the heart. Over years, fatty deposits called plaque can build up inside these arteries. The artery becomes narrower. But the real danger can begin when that plaque suddenly ruptures. Your body reacts by forming a blood clot. And if that clot blocks the artery, blood can no longer reach the heart muscle beyond the blockage. Now imagine a section of your heart suddenly being cut off from its oxygen supply. At first, the muscle becomes starved for oxygen. If blood flow isn't restored quickly, heart cells begin to die. And the longer the artery remains blocked, the more permanent damage can occur. This is why doctors treat a heart attack as an emergency where every minute matters. But here's something many people don't expect. A heart attack doesn't always feel like a dramatic, crushing pain. It can feel like pressure, squeezing, heaviness, or discomfort in the chest. The discomfort can also spread to the arm, shoulder, back, neck, or jaw. Some people experience shortness of breath, cold sweats, nausea, dizziness, or unusual weakness. And some heart attacks can even happen with very mild symptoms or without obvious symptoms. If the blockage is treated quickly, doctors can work to restore blood flow and limit the amount of heart muscle that is damaged. One common emergency approach is opening the blocked artery with a catheter, sometimes using a balloon and a small mesh tube called a stent. The goal is simple: restore blood flow before more heart muscle is lost. And here's the crucial difference. A heart attack doesn't necessarily mean the heart has stopped beating. A heart attack is primarily a circulation problem. Cardiac arrest is an electrical problem that causes the heart to suddenly stop pumping effectively. But a heart attack can sometimes trigger cardiac arrest. So if someone has possible heart attack symptoms, don't wait to see if they disappear. Get emergency medical help immediately. Because when it comes to a heart attack, every minute can mean more heart muscle at risk.